You've mastered intraoral scanning, but what really happens after the scan is finished? This is where the real efficiency, precision, and long-term value of digital orthodontics actually begin. Hello, I'm Dr. Baxmann, and today I want to walk you through what comes next after scanning, and why post-processing is where digital workflows truly outperform traditional impressions. Once a scan is completed, you essentially have raw digital data. Many practices simply export that file and send it to a lab or milling center. That works, but it also means you're handing over control, time, and flexibility. Modern orthodontic software allows you to take full ownership of this step. You can process, analyze, and prepare models entirely in-house, often in less than a minute. With the right software, raw scan data can be trimmed, based, aligned, and labeled virtually. Everything a technician used to do manually, pouring plaster, creating bases, mounting models, now happens digitally. Upper and lower jaws can be aligned perfectly, leveled, and prepared with just a few clicks. This is where the real-time savings come in. The scan itself might only be marginally faster than a conventional impression, but post-processing eliminates hours or even days of downstream work. Once the digital model is complete, it doesn't stay static. Each individual tooth can be segmented and addressed separately. That means the model is no longer just a visual record. It becomes an active planning tool. You can move teeth individually, simulate treatment steps, and prepare the model for aligners, appliance fabrication, indirect bonding, or printing without recreating anything. A critical factor here is accuracy at the very beginning. Bite registration must be done correctly. If the bite is scanned poorly or only captured on one side, errors will carry forward into every next step. Multiple bite reference points combined with clinical photographs are essential. Photos allow you to verify midlines, symmetry, and jaw relationships so the virtual model truly reflects the patient's reality. The principle is simple. If the input is flawed, the output will be flawed as well. Once models are properly mounted and verified, digital indirect bonding becomes one of the most powerful applications. Brackets can be placed virtually with full visibility, even in posterior regions where clinical bonding is most difficult. There's no saliva, no cheeks, and no limited angles. You can rotate the model freely and position brackets with far greater precision. Bracket heights can be preset based on tooth anatomy and prescription, then fine-tuned manually where needed. The result is increased accuracy, especially where errors most often occur. Today, indirect bonding no longer requires printing physical setup models and thermoforming trays manually. Transfer trays can be designed digitally over the virtually placed brackets and printed directly. Fit, stability, and bracket positioning depend entirely on scan quality and precise digital design. When done correctly, this workflow significantly reduces chair time and improves clinical outcomes. Beyond bonding, digital models support comprehensive analysis. Classic orthodontic assessments, space analyses, and documentation modules can all be integrated. Treatment quality becomes easier to measure, compare, and document over time. Advanced features also allow aligner planning, virtual bracket removal for retention preparation, and even appliance design before fixed appliances are removed. Digital orthodontics is not about gadgets. It's about structure, planning, and clean workflows. If you prepare properly and work accurately from the start, the error rate drops dramatically and efficiency increases across the entire practice. The technology is already here, and it's moving fast. The real question is whether you're ready to fully use what your scans can already do. If you found this helpful, make sure to subscribe, leave a review, and share this episode with colleagues who want to work smarter, not harder. I'm Dr. Baxmann, and I'll see you in the next episode.